Hi, good morning, everybody. This is Dr. Zishan. So welcome to our brand new color-coded clinchers and curriculum for PLAB. So I would be starting with a quick introduction about myself. I will share my screen and I would talk about how I have created these color-coded clinchers and what's about me and what's different about these color-coded clinchers. And I want everybody to understand it, what it is, and how we will be studying throughout this course, and how the mentors would be providing you support and help. So how it is different, I'll talk about that a bit quick introduction about myself. My name is Dr. Zishan Ghaffar. I'm emergency medicine doctor based in Manchester. I have around 3 years of experience in NHS, and I've been a teaching fellow and also mentoring medical students and doctors throughout PLAB and UKMLA. And since I was in my medical school, I developed a passion of teaching and training. And in a different way, in a conventional way, I have worked closely with the neurodiverse learners, specifically the people having a problem with the focus and the problem with reading through the books, people with the dyslexia, neurodiversity, people having ADHD, because a lot of people struggle learning things and they do not know how to learn those things. So that's why I've developed this color coded clincher, which is being used by a lot of other mentors and the notes maker educationists. But this is a bit different because I'll try to cover that gap in PLAB 2. Basically, what's the gap in PLAB 2 is that a lot of notes are here, long notes are there. So I am basically focusing on the good medical practice. I have created the one-liner clincher. What does that mean? So that means someone is coming with a presenting complaint. What they present, they talk about, I have a chest pain. How would you explore that? And what are the 4 buzzwords in the history you would must ask? Then you would make a diagnosis. And then what are the buzzwords in management you must ask? And how you will follow through in 8-minute consultation here. What are the key areas in 8-minute consultation here? You will follow through this. So my mentoring technique is basically 100%, not 100%, I would say. I'm trying my best to align it with good medical practice. And what good medical practice, I'll walk through that in next a few pages of my booklet, which I've created fully free for everybody, and you would love it, you would like it. And let's start building confidence if you are in the middle of your PLAB 2 journey, or even if you just started or your exam is just in 2 days. So let's building up a confidence in a professional way for the both exams and after even you will be working as an NHS doctor. So first of all, I'll talk through this thing. So what is basically my introduction? I already told about that. I love creating mnemonics, color-coded clincher, especially designed for those who find long distance, long, dense, difficult material to process, difficult to breaking into. I have tried my level best breaking it into digestible, focused, visually memorable chunks, so that you would understand what are the key point in a scenario. I am deeply committed to the medical education and helping students, doctors, not just exam, but truly apply good medical practice. So doctors, I want to take a moment to congratulate you now, because you already registered with your PLAB 2 and your exam is just in 2 days, 3 days, 4 days, 1 month, 2 months, 3 months. And exam is a huge step forward. It's not just another test, it is the gateway to the life and career, and you have been working so hard to get through this, and you are here in the UK now, you are in process of getting visa, so you are going to enjoy all part of your PLAB 2 journey. You have the knowledge and you have the drive and you have ability. You are closer for the greater challenges. You already passed a lot of greater challenges in your life. So from medical school to countless sacrifices, doctors, you have done everything. There was sleepless nights, there was personal hurdles, you gone through everything. That means you are a doctor, you already passed PLAB and you already passed medical school. So nobody can take that from you because you're a doctor. Everything you have been through has prepared you this moment. So this moment means that you are about to take this exam to showcase your skills. The key now is approach your PLAB 2 journey with clarity, focus, confidence, and positive intention. So I say positive intention. When I say positive intention, what does that mean? Positive intention. When I talk about the positive intention, that's the key to pass your exam, doctors. So when I say positive intention, that's the key to pass your exam. So if you understand this concept of positive intention, doctors, you will pass this exam. Okay, so let's begin with few tips. Here are a few tips to help you crack your exam on the very first attempt or next attempt. So let's start with the positive intention. So let's say your exam is in 3 months time, 2 months time, or your exam is just around the corner in 3 days, 2 days. You need to be positive. So first of all, you need to know your resources. Don't drown yourself in endless materials. Keep your prep focused, strategic, stick to essential like UKMLA blueprint. So you would get this clincher book, which when you will click it, you would be able to go to the UKMLA blueprint, which will be a clickable link. Good medical practice in action nowadays. You would have a lot of cases there. You can click and you go there. And I have summarized this booklet clinchers from the good medical practice and also from NICE guidelines, BMJ best practice. And I'll try to, mostly I tried my level best to help you guys mastering the art of 8-minute consultation, and that's the key to pass. And yes, make sure you know at least 8 buzzword in each consultation easy framework. So this is what I have developed, and I will talk through those in a minute. Okay, so let's talk about understanding cases. Don't just memorize. What does that mean? You don't need to memorize every past case. Why? What matters for more is learning how to think and respond like a safe doctor. So if anybody is going to give you cases that these are the real cases, these are the real concerns, trust me, that is something which is not helping you, is making you a robotic doctor. So be adaptable. Most PLAB stations are based on common situations, especially how you will be working as a junior doctor in GP, how would you be working as a junior doctor in ED setting, and they are designed to test your professional judgment, not competencies in terms of senior doctor. They just want to see how competent you are to work in a team, not just your medical knowledge. This exam is about how you listen, how you reassure, how you explain, and how you act safely, doctors. So these are the key areas you need to understand in this section. Okay. And all of that should be aligned with good medical practice. I repeat, good medical practice. Master the basics, don't over prepare. Master the basics mean you should know the few frameworks, which I will talking through. What are the history taking framework? What are the other frameworks? You just need to master that. Please don't fall into the trap of blindly memorizing recall cases or recycling the same concerns from so-called recent exams resources. Why? Because it is against medical practice. It will not make you a good clinician. It will not make you a good doctor. I still remember that one of the GMC head examiner said before my exam in PLAB 2, we know doctors go to academies and cram over case pools. So they're saying, yes, we know that you remember and memorize those case pools. So they are aware of that, but keep your eyes and ears open. What does that mean? We change cases and we change patient concerns all the time. So this is what they are saying. So that means, in short, if you memorize patient concerns, which is built by any of the exam pool, it is sort of cheating. When you try to cheat the system by memorizing scripts, or scripts mean the same scripts which been in the last week exam or this exam, that cramming recalls your risk sounding robotic, unnatural, and unsafe. However, you feel like the cases are from the resources which you study, but maybe there is some problem with the examiner who marked you. No, the problem could be something you sound robotic, you didn't sound safe. So that's the key thing you need to understand. Now, even if you pass this way, you may feel underconfident. Underconfident mean, what does that mean? And when you start working in an NHS, when you pass and you feel like there is a knowledge gap because you just studied few recalls and exam cases scenarios and you answered it and luckily you passed. But what about the doctors who've been studying all the cases from NHS, CKS, and everything, and they didn't sound robotic, but maybe they failed with the 1 or 2 score. So this is something which is sort of cheating, I believe. Ask yourself, if you pass PLAB 2 purely by cramming, will you really be a safe doctor in real clinical practice? Will you be? Write in the chat box if you think you will be a safe doctor just memorizing few cases which might repeat. No, you will not. You might get every diagnosis right, but if examiner senses that you already know the case, they are trained to spot it, you will lose marks. Okay, worse, what worse could happen? You could score 0 for major mistake if they feel you are not being authentic and you used information out of the scenario which is not being presented in the same scenario, which seems like you had a biasness by reading the case pool, and you became biased and you have vomited few information which was not in the case. So how the examiner would respond? Examiner would judge, maybe giving you low score or maybe even failing you with 0. That is what I want to speak about. So be natural. Be natural mean that you speak naturally. How you speak doesn't matter, how your accent doesn't matter, what ethnicity you have doesn't matter. So you try to use your hands, how you can use your hands, how you can speak. These are all the things which will be communicated and judged in your PLAB 2. It's not about what you doing perfection way. So this is how just a bit about introduction about preparing in a good way, like a good medical practice. What is good medical practice? Let's talk about what examiners love. So examiners in PLAB 2 are already familiar with the scripts. They are familiar with the scripts, phrases, and used by every academy. So the key to standing out. So how would you stand out from the other doctors? So I will talk through the marking scheme. I'll tell you why doctors usually fail with 1 mark or 1 station, and most of the doctors fail with 1 mark or 1 station, and why they fail, why this system works in that way, that a lot of doctors just fail with 1 mark or 1 station. So basically, standing out is authenticity rather than something rehearsed. So that's the key, how authentic you are as a doctor. Approach every station as a kind, smiling, humble doctor with gentle and polite, someone who truly listens, makes patient feel heard. Focus on mastering basics, applying them safely, being honest in your preparation. Always prioritize patient safety and ethics over memorized textbook line. In British medical culture, a genuine smile can be a long way in building rapport and trust. So your smile can change things. When you enter into the cubicle, your smile can mesmerize examiner. Your smile can hypnotize examiner. Your smile and the way of talking can build the first initial 1-minute hook. So in a teaching, in a making any videos, or as a doctor as well, the first 1-minute hook is something which patient would understand what type of doctor you are, and the examiner would understand what type of like junior doctor you are. How would you carry your case? So the first minute is a key. Throughout your consultation, demonstrate core ethical principles. So we'll talk through, when I'll be talking about different frameworks tomorrow, about different medical framework, acutely ill patient, and we'll be covering all the frameworks. I'll talk about that, and these 4 frameworks we will use in medical ethics autonomy, where the patient have choices to make their own decisions. Beneficence, you will not, whatever you will do will be for the patient's best, and non-malfeasance, by avoiding any harm. Justice, you will be not doing in any sort of discrimination, and you will be using NHS resources with the justice. This is justice, and it's also related to the clinical governance. We'll talk about that anyway. Okay, so I know I'm talking loads of things which it might new to you, but don't worry, we'll cover everything in the form of chunks, clinchers. Then I'll tell you what is my clincher system, which we will be doing. So let's talk about. So this is a scan. all the academies are scam. Trust me. I know I have academy. I would not say that is an academy. That is just a practice area for the IMG doctors, and it's that practice area just not in UK. I have built that practice area in Pakistan, do different cities. I'm building. I'm saving money from for the auctions of building practice area in Bangladesh, Nigeria, where the doctors can practice there. So basically, you just need a practice area, you just need a partner, you just need a mentor. So academies will not get you past. That's the truth. And sometimes academies make you a robotic doctor. Even if you go with your natural skills, you still can pass if you just go through the CKS NHS. So no academy can pass this exam for you. Trust me. This is you who will pass, and this is you who will fail. If you do not take ownership of your preparation, stop chasing perfection. I mean, you do not to be a perfect passing PLAB. You do not need knowledge. You already have the knowledge. The examiners are not expecting you to perform at the consultant level or achieve every competency flawlessly. They are looking for a safe, structured junior doctor who has a practical, right way with the right guidance. Focus on understanding symptoms, symptomatic treatment, forming sensible differential diagnosis. So you do not, doesn't mean that you do it you tell the diagnosis you will pass. No, I've seen a lot of doctors who have done all diagnoses right and they failed all the stations. So this is what I'm trying to say. Doctors, please, please, please understand safe symptom-based management. Know your patient. Don't lie. This is what we do. Don't say that you will do surgery. Don't say these specialties need to know. Seniors need to know. Okay, so this is what the heart of good medical practice. Know your limits. Accept your mistakes. If you cannot cannulate, you try 3 times, apologize. I cannot. I need to involve my senior. So this is what you need to understand what's good medical practice is. It's not about having every answer. It is but about being honest, self-aware, safe. That's the most important thing in PLAB 2. What makes PLAB 2 unique in UK emphasizes on medical law. So I would like always to give one example. What is that example? Is that, for example, if in your country you're driving right or left, or you come to the UK, you have to drive another way. Maybe you have to drive, for example, you have to drive right, and in your country you're driving left. So what would be there? There would be a bit of hesitation, but you're still a driver. You still can drive. How to remove that hesitation? So you need to understand driving laws. So similarly, if you want to practice in UK, you need to understand medical law. You need to understand what is safeguarding in UK for the children, vulnerable adults, mothers, women, or then cultural awareness. What is common in UK cultures? What is confidentiality? What is gum clinic? And what are the different settings you need to understand? If you understand those settings, that's the one thing what you need to know in the start. Then how you would communicate. Learning the NHS way means developing not just clinical skills, but the professionalism, empathy that make patient, colleague, and examiner trust you. So that means they want you as an all-rounder. So when you will be speaking to your colleague, how would you speak? When you're speaking to mother, how would you speak? When you're speaking to your consultant, how would you speak? When you're speaking to your junior and teaching someone, how would you speak? So they want all-rounder. Trust me, PLAB 2 will change you a lot. You will not understand now. Once you pass your PLAB 2, you understand how your practice has been changed, how empathetic you become. So this is something which I always tell my doctors, colleagues, that always ready to help, be empathetic, be a very simple, humble doctor. So this thing which I'm going to talk about here now, I'm sorry, I speak very fast. I'll try to slow down. Okay. So stay away from negative energies. What does that mean? So been teaching PLAB from 3 years, and also been teaching, I've taught medical students, and also I have seen the high achievers. High achievers mean not only for the PLAB to or the people who pass their exams, including PLAB or other exams, MRChem exams, even Australian Medical Council exams or USMLE. So they have one thing common. So there are two type of candidates, or very specific in plabbers. Highest achievers aren't always the one who know the most. They know the techniques. They are the ones who bring positive energy into everything they do. Trust me. positive energy. Energy has a whole impact. So let's talk about energy. So I wake up early in the morning, for example, and I have a cup of coffee. If I'm smiling and I'm very chatty, even if like I'm talking specifically about PLAB, trying to make new friends, saying hi to someone new, maybe on the walking, I say hi, hello, smile. And when I see, for example, when I see there is a rainy weather, I take it as a blessing, not burden. I'll keep umbrella with me rather than just staying home. So the rain in UK Manchester is a very common thing. A lot of doctors say, "Oh, it's always raining." So what does that mean? Always raining means it's a weather, it's a blessing. So how would you react on that? You need to understand. So they show up. So the first thing is that practice is the key. They show up in the practice area with the timers, respective mentors. Anyone, that mentor could be someone your senior from the NHS, or the mentor could be someone who recently passed your past PLAB, or mentor could be anyone you took some classes. So that's the one thing you need to understand. So they show up consistently, practice with the timers, respect their mentors, help others. Their good energy not only lift their own spirits, but inspires those around them. That means they want to help everyone. Okay, they are givers and they want to help themselves. So this is a cycle. So that means they want others to pass and they want themselves to pass in a way with the positive energy. I have seen people pass with a little time as 15 days of preparation. I have countless names from my doctors, my students, who have passed within 2 weeks with the positive intention. So let's say I've seen a doctor who just said that 2 weeks, and if I fail, I'll rebook. And that doctor passed, and with the flying score. That means positive intention change everything. Everybody know the theory of attraction. So if you want to do anything, and there is a energy, the particles and everything would help you, but should have a positive intention and hard work to do it. On the other hand, I have seen candidates failing multiple times, not because of lack of knowledge, but because of self doubt, over preparation, discouragement from someone close, or even mentor, negativity, or entitlement that I cannot because my this, I'm not good at speaking. I'm not. Doesn't matter if you are introvert, yes, you can fake. You have to. If you're a doctor always need to smile despite whatever going inside their head. So you cannot be normal person every time. You need to understand, you need to smile. Sometimes you need to fake smile. That's the truth. If you're introvert, if you're going through something like you do not like to interact with the people, maybe you are on spectrum, or you don't like speaking to people, how would you do it? You just have to do it because you want to become a doctor. But if you are monotonous, you need to improve it. You need to fake it. If you have watched the season The Good Doctor, he got autism, but still he developed skills, communication improved over the time. So this is your coping mechanism. This is the time to develop your coping mechanisms to pass this exam, to be chatty. Okay, so what you need to do, it's too noisy. So negative people would say it's too noisy. I'm not I'm not targeting anyone, guys. I'm just trying to say if you think that way, you need to understand things will not be the same you want. Okay, it's too noisy. I can't study. I need to first prepare all my notes. I need to do this. The bus takes too long. These are the common things which I have noticed. I cannot come to the practice area. I need to study all 5 type of notes at home first. Guys, notes are built from CKS NHS. First of all, you need to understand. Notes are built from CKS NHS. I will be giving you a framework to understand how to make your own notes. Throughout those color-coded clinches and lectures. So what they would say, I need to study all 5 types of notes at home, compare that with the mindset of positive candidate. What they would do, they would say, the coffee is perfect for studying. I love coffee. I listen to the Breaking Bad News podcast on the bus, or let me record myself and I will reflect later, or maybe I'll send this recording to Dr. Zishan, or I will send this recording to my colleague who's working in NHS. Maybe I do record psychiatry consultation. I'll send to my psychiatry friend who's working in NHS. What it would take, they'll send you a 2-minute feedback. So this is, you need to understand. Sadly, there is a one thing which I've noticed: candidate with the bad intentions create overly difficult scenarios while practicing with their colleagues. What they demoralize others because they are doing fine, and they create very difficult cases. So please don't practice with them, or politely tell them the case is not this way. So the calibration is totally different, and how aortic dissection would present, how common chest pain would present, how BBN would present. So there should be a simple structure framework, which I will show you every bit of these color-coded clincher. Okay, don't take exam. Okay, few of the mentors I have noticed, sometimes the students are left with 1 month, 2 months even. They say, just don't take the exam. Why? Just take my course and study 3 months, come here. Guys, it's very difficult to live in UK. Why anyone will tell you delay your exam? Even if you delay your exam, if you fail after 4 months, still you have spending a lot of money to live and survive here. They need to understand it. If you pass, you pass. If you fail, the 1 month of living can rebook your exam. So that's the thing what I'm trying to say. Failure is not failing this exam. Failure is something failing in a wrong way, failing in a way that you do not feel happy while preparing this exam. You do not enjoy. That's a failure. I have never told any of my students that they would fail. Never, ever. I never. So this is something, if you learn over that period of time, I learned over the period of time, a good mentor encourages, highlights strengths, and constructively works on weak areas. Real progress comes from building confidence, not breaking it. So why? Because if I listen to any consultation and I start giving a negative feedback from the what for a junior level doctor, no, I'm not a good senior then. I need to come to encourage them what have their stronger areas, what they're doing great. So if someone is constantly discouraging you, so this is a pro tip, guys. If that is your senior, your brother who's working in NHS, your husband, or anyone who is a senior doctor working in NHS, and they discourage you and radiating bad energy, walk away. Don't practice with them. Protect your mindset. Walk away, guys. Protect your mindset. Just practice with the people who are polite, who give you a good feedback, and double check your feedbacks according to the GMC frameworks. Okay, so this is how we would do. Surround yourself with the people who believe in you, lift you up, and bring out your best. That's what is all about PLAB 2. Okay, so trust me, guys, PLAB 2 is one of the easiest exams I ever seen taken. If you're ready, if you're ready the right way. PLAB 2 isn't mean to be nightmare. In fact, it can be one of the most straightforward exam if you approach it with the structure, empathy, kindness. Stay humble, be willing to help, and let this journey shape you in a better doctor, not just for exam, but for your entire career. So let's talk about framework now. So these are the few things which I have experienced from past 2 to 3 years about the PLAB candidates, especially PLAB 2 candidates. So basically what I'm going to talk about here is the framework. So what I have developed, whole of this system, I would not say these are notes, because notes are a lot of notes are here. I try and develop a system, a framework. So that is a one-liner color-coded clincher technique. So over time, I have developed a unique clincher technique for PLAB 2 that has helped already hundreds of candidates pass, but it was not in the form of written document. It's built around eight high impact buzzwords, 4 from history and 4 from the management, and is designed to fit perfectly into the 8-minute consultation format using in the exam. The method mirrored the real life clinical presentation you will encounter every day as a junior doctor in GP emergency setting. It is the same approach I use myself to pass PLAB 2 with flying colors and course colors, and it's now empowering doctors from all over the world to do the same. So I would share few examples, and then I would be releasing that clincher booklet for free for everybody, but it's still in process of doing editing, and it's a highly demanding task, and a few things we're just improving on that, and we'll try and put a few things. So first you need to understand what's the format. So the format is it is a one-line clincher. How it would start: presenting complaint, so one word presenting complaint, then four high-yield buzzword from the history. Then there would be clinical diagnosis written in a simple word, and after that there would be four management buzzword, which is based on NICE, NHS, and CKS. Okay. And this is how we are doing the I will be teaching those frameworks now. I'll tell you, I will walk you through those frameworks, and we'll tell you how we will use those framework, what is clincher and what is the system. So the copyright is very simple. This content is summarized from this guidelines. Is common patient concerns adopted from publicly available NHS website, and I tried my level best. Not the material is protected, not be copied, reproduced without distributed without proper credit. Also, I tried my best to make it as aligned as possible according to the good medical practice, to avoid discussing any specific or confidential exam cases or concerns. Most of the scenarios include all the common presentation that doctors expected to handle in the real world in UK clinical practice. Okay. Now, this is the key thing you need to understand: how this framework would work, how to use this free PLAB to clincher booklet. So basically, what I have done in this booklet, you will be seeing three things. Two things are free of cost. That means the framework free on the, you will see all the frameworks, which would include simple consultation framework, breaking bad news, or all the frameworks you would able to see it, access it, read it in the form of color coded. The clinchers would be free again. It would be one-line clincher. I'll show you how the clincher would look like, and you would be able to see it, but it would be color coded, which would be followed by videos decoding those clinchers by mentors from our academy or myself. And then a master table. The master table would cover that framework embedded in the table and the approach, and those clinchers would be explained in the form of whole big table. So this is how this framework would work, and it would be uploaded along with the videos. So what is this booklet? Is not just set of notes, it's a complete PLAB 2 preparation system built to take you from zero to confident structure exam ready. It works three powerful steps. The framework: you first step for every presentation. Each section begins with a simple high yield framework for the presentation, distilled from CKS, NHS, BMJ best practice, good medical practice in action, and trusted PLAB 2 teaching approaches. Written in talkative, easy to grasp style. It tells you exactly how to start your assessment, what key positive finding to look for, and the safe step to follow in the real NHS practice. You will find it loaded with the mnemonics, analogies, and techniques. Like I have developed one technique, AIMS. So let me tell you what AIMS is. A for assessment, I for investigate, M for management, and S for safety net. So it's a cycle, AIM cycle. A to E, common example for acutely sick patient, I've developed a technique. 4M technique: mouth, monitor, mask, maneuvers, how to use them. Then 3Cs, what 3Cs mean, that is a breathing part, and 3C means chaperone, chest examination, and chest x-ray. And then what are the few other techniques similar for Vs, for Bs, everything is coded in the acutely ill patient, that is thin man. So the clinchers, how the clinchers would look like. So this is a basically rapid recall case coverage. That means you can recall all of your knowledge, and very straightforward in this framework. Once you have the framework in the mind, you move to the clincher. So first framework, then clinchers, and then table. So this is how you will go and you will consolidate your knowledge. So once you have the framework in mind, you move to the clinchers, and you try to read 8 buzzwords, common positive findings, actually, or arrows that cover every key scenario and differentials for each case. You will know 4 must ask history questions, core differentials, 4 management buzzwords like from the NICE, NHS, and CKS guidance. These clinchers make your preparation laser focused, prevent you from getting lost in irrelevant detail. And then you would have a master table. The master table would cover everything, and it will cover embedded with all the approaches and cases. Every section section ends with the color-coded master table, personally verified by me over mentors, and brings everything together. Framework, clinches, and approaches for every case. This table is your final consolidation tool covering all GMC PLAB2 marking domains. What are the marking domains? So let's talk about marking domains of PLAB2. So those are data gathering, clinical management, and interpersonal skills. It's fastest way to review everything before your exam day. By following these 3 steps for every topic, you will not only pass PLAB2, you will also develop habit, structure, and clinical safety that NHS expects from UK doctor. So the clincher booklet is completely free for all. That's the good news. It is completely free for all and covers all common cases you need to know. Okay, and I really put a lot of efforts in that booklet. So I've been devising off and on those clinchers. I know I promised with a lot of doctors from the previous batches, but I never able to complete it due to my clinical commitment, due to my own limitations, and due to few other factors. But now, though that booklet is completed and have every sections ready, but we are going through the final process of editing it and making it available for you guys. So again, it's important. The important announcement is exclusive decoding videos to our learning management system, which will be uploading from today onward, and all the videos will be accessible for later view of all the people who would be registered and watching those videos. So this is what it about our this section. So in the next section, what I'm going to do, I'll show you example of one clincher, and then we would talk about what are the different things you need to doing in that way. Okay, guys. So, okay. Okay, guys. So let's talk about this framework. So this is a first example of the framework, which is I'm talking about PLAB2, how you are scored on. So first of all, you need to recall what are the different sections in PLAB2. So you got 16 stations and you have 8 minutes each, and you would have 3 domains. And you to pass overall, usually you need 9 or 10 station needed to pass, depending upon according to the NGOF criteria. So station judged, so how you would be judged on. So that's a little bit of very like it's tricky and it's difficult to understand how you passed on, how you marked on. So station judge, so they set a criteria, minimum safe UK doctor standard is decided by the examiners, and then they understand the score threshold and they set it. And then your score being compared with your colleagues who are taking that exam that day. And pass mark vary by stations and cohort. So this is basically what it is. You can pass or fail depending partially how other perform. And yes, sometimes it comes down to just 1 mark or 1 station. It's quite unfortunate. That's why I always say PLAB is an exam of competencies, acceptance by system, by nature, or your professional nature, plus your luck. So this is how you will be passed or fail your PLAB2. To stand out, hit every domain consistently, every approach, every framework, different framework consistently. Try to be doing it every day so that you have holistic approach to PLAB2 that show safe UK standard practice and leave the examiner confident you fit for practice in UK. So now, what is domain 1? So you don't need to worry much about, because I have developed a lot of frameworks. Tomorrow video will talk about all the frameworks, including all the type of approaches in the PLAB to what you need basically to start with to understand the frameworks of the history station, follow-up stations, and all the approaches, which I'll talk about tomorrow. Data gathering. So first thing is data gathering mean is a history. Yes, it's a history, but it's a different way. So open with history, then you would, before even start examining, then lead to diagnosis. So up till diagnosis, you are in the domain 1. You need to understand up till diagnosis, when you start explaining finding, you are in the domain 1. So how would you open, build rapport, smile, introduce, confirm role, consent, ethical check if needed, if chaperone is needed, if you think the patient need confidentiality, you will do. Then history, would include red flags, systemic review, ideas, expectations, concerns, and psychosocial bit. Then examination would be relevant, focus, examination, explain as you go. And then you will consent again and maintain dignity, then lead to diagnosis. You would summarize findings plus correlate history and exam plus prepare for explanation. So that is basically the part where you would explain about the first domain, and you will be scored on that, and you will be scored for each domain. So a total of 12, and the passing score different from 6 to 12. So this is, it used to be less sometime in points, but now this usually the score is now 6 to 12 passing score. Now, clinical management, it would be different for different cases, but the basic thing you will be scored on how you made it diagnosis, you explained findings, what is your provisional diagnosis or DDs, what options and what are the plans you have discussed. Did you explain the results in the normal English or avoiding jargon, checking understanding, or diagnose was stated clearly or linked to the symptoms or finding concerns? Did the doctor confirm patient understanding or not? Options, that did you talk about specialties involved in that case? Did you talk about special tests, specific test, or special investigations which needed to confirm that diagnosis? Or did you mention specific treatment? And finally, have you safety netted to put the patient in the cycle of continuous care? So shared decision plus patient-centered safety netting and red flags when to return to the follow-up. So this is the key area in the UK consultation, 8-minute consultations, and it must show all the skills like interpersonal skills. So the PLAB 2 is not about talking. It is about connection. It's about listening. It's about empathizing if someone is very like low, if someone have lost anyone, if someone is worried, if someone is angry, if someone is happy, how you celebrate with them. So this is what they're expecting. So are you listening them? Are you the only master? No, you're not master. Doctors are not master. Doctor is a slave. I always tell my doctors, whenever you do examine anything, just go on your knees, speak to your patient on your knees who are old, just go on their level. This is listening, this is active listening. Just do head nodding, connect with them, empathize them, celebrate with them, whatever you could do that. Smile with them, laugh with them, support them. Connection is first minute count. Okay, when you enter into the room, the connection with the examiner, with the smile, and then connection with the patient itself is the most important thing. Smile, warm tone, introduce, professional but friendly. So this is what 3 domains are of marking. So we will talk about more things on that, but now I would be talking about a sample clincher. Then we will talk about what is our LMS system. I'll show you the LMS system, and then we'll take it from there from tomorrow. So how the clinches would look like. So let's start. Okay. So the clinches would look like this.